7th meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Ms. Andrews, Mr. Daniele, Ms. Cayley, Mr. Lightfoot, Dr. Quattro, Mr. Rocco, Chairwoman Draw.
Here. Is there anyone here signed up for public forum?
There is not.
Okay, thank you. Then the next item on the agenda is the approval of the minutes. You have before you the August 24th, 2011 minutes. They will stand approved unless the clerk is notified of any changes by the end of the day. Next item on the agenda is new business. Madam Clerk.
Referral 11-219.
Moved by Legislator Rocco, second by Legislator Quattro. Any discussion on that? No? Okay. All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-220.
Moved by Legislator Quattro, second by Legislator Daniele. Is there any discussion on this? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration, the referral indicates that there's a significant decrease in funding due to cuts from New York State in the New York State program. I wondered if someone could speak to if you expect to see any impact on this due to the significant cut, and if so, how that's going to be addressed.
Dr. Dignan is here, the medical examiner. She'll address the question.
Thank you.
Through the chair, the grant that's being accepted is going to cover the cost of maintenance of one instrument as well as one person, one employee. But clearly the loss of the difference is going to have an impact in our ability to do our testing and in a timely fashion and to have additional assistance in terms of employees.
Thank you. So what do you expect to see then through the chair? Is a longer time period to do the work, or a layoff of employees, or what do you?
I think, well, through the chair, I think the biggest thing at this point is going to be a reduction or an increase in turnaround time for test results.
Thank you. And can you any estimate on what sort of increase you expect to see?
Not at this point, I can't say.
Okay. Thank you.
Thank you, Dr. Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-221.
Legislator Daniele, second by Legislator Rocco. Any discussion? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration, I know we talked about nurse-family partnership quite a lot over the past couple of years, and is there any plan at this point in time to grow this program to surpass the approximately 300 families that we're currently serving?
Through you, Madam Chair, at this point, unfortunately, we do not have plans to grow the program, although we would very much like to do that. Some of the funding streams that we've had in the past have fallen away, mainly the COPS funding. And so we've been scrambling just to keep the level of the program as it was before.
Thank you. Through you, Madam Chair, how much did you lose in COPS funding?
Through you, Madam Chair, about $600,000 a year.
Thank you. And that's for the current 2011 year, or is that for 2012, or that run on some other year?
Through you, Madam Chair, it actually runs on another fiscal year. I believe it runs October to October, if I'm not mistaken. So we've been without the COPS funding back to last October, or is it until this coming October? It runs out this coming October.
So 2010 to 2011 Octobers.
Through you, Madam Chair, it runs out at the end of this September.
Okay, thank you.
Any other questions? Legislator Andrews.
Through you, Madam Chair, a few months ago, or perhaps more than that, we talked about waiting for authorization, I think, or guidance in terms of using some federal funds to offset some of the costs for the Nurse Family Partnership Program. My understanding is that that happened and is now occurring. Can you talk a little bit about what the effect of that is, or how much we've received in federal funding for this program, or how you're using that?
Through you, Madam Chair, we haven't received official notification of that. I believe it was just last week, actually, that the federal government told the states the amount that they would get. And based on that information, we believe that we will be awarded approximately $540,000, which is pretty close to what we're losing in COPS funding.
Thank you. And so would you expect that to run on a similar year as the COPS funding that we've just lost? I mean, is this going to be about $540,000 starting in this coming fall going forward through the chair?
Through you, Madam Chair, I just don't remember that number, but we'd be happy to get it for you.
Okay. Thank you very much.
Thank you. Okay. Thank you. Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-222.
Moved by Legislator Rocco, second by Legislator Quattro. Any discussion? Legislator Andrews?
Thank you, Madam Chair. The referral indicates that this is the first year the county's received this grant for the Lifespan Respite Initiative project. Does that mean that this is the first year that we've contracted to provide this service, or just the first year that this grant's been available? Or can you explain, please?
Corinda Crosdell, Director of Monroe County Office for the Aging, through the chair. Yes, this is the first year that you'll be voting on contracting with Lifespan to provide the service.
Thank you. Did a different vendor provide the service in the past, a different agency?
Through the chair, no, this is the first year that the state's provided the funding.
Thank you. Is it your expectation the funding, or your hope that the funding will continue to provide the respite services?
For at least for at least 3 years, yes.
Okay. Thank you very much.
Any other discussion? Legislator Lightfoot.
Thank you, Madam Chairman. Through you, Madam Chairman, could you just explain a little bit about respite? I'm familiar, through you, Madam Chairman, with some of them. My mother's a foster care giver, and I know sometimes she has to take some of her clients, or the kids, to respite. But this seems like it's more for disabled and obviously seniors. So through you, Madam Chairman, could you just explain to me a little bit about what this program is going to do, or what you see it doing, being that it's the first year, and how many people, because it says it's serving them and their families, do you anticipate this providing services for, through you, Madam Chairman?
Through the chair, this is actually going to be a statewide initiative to set up a caregiver database.
Okay.
And it's geared towards assisting caregivers find services for exactly what you mentioned, long-term care and senior services. Our focus is really on agencies, not so much individuals. We want to get as many agencies in this caregiver respite database as possible. At this point, we're up to about 400 agencies, and we expect to grow that over the next 3 years.
So through you, Madam Chairman, this would be something that is used by the state to refer services, or is it used by the state to get these particular agencies? And what is this? I mean, how is this data going to help individuals? I guess is how I'm trying to, through you, Madam Chairman.
Through the chair, it's a resource for individuals who are providing services for long-term care. So it's for the professional service provider as well as for caregivers, such as the example you used with your mother. So if she was caring for an individual, a child who had long-term care needs, she can go into that database and find services in an area no matter where she lived in New York State.
I see. Thank you.
Legislator Haley.
Thank you, Madam Chair. Just one question, if I may, through the chair. In this database and the registry that will be open to the public to use or utilize, at any point will any of this initiative actually, I don't want to use the word rate an agency, or, well, I don't want to use the word rate, but will there be any guidelines as to an agency's past performance that would be available for someone to choose? In other words, if you were choosing from column A, say how much information will be on this is what I'm asking.
Through the chair, the vast majority of the information will just be services that are provided by that agency. we wouldn't dictate quality of services because it's very individualized. Some people are going to like some services that agencies provide, and some people just aren't.
Okay, thank you. Then, will you be indicating the scope, well, the services certainly, but also the capacity of an agency? Say if they have 500 families that they're servicing, or I guess a number capacity at all? Thank you, through the chair.
Through the chair, I'd have to go back to our contract agency to see the exact parameters of each agency that's in the database. It's mirrored after our New York Connects database, and we do provide that information.
Okay, thank you.
Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Are there any other matters to come before this committee tonight? Legislator Andrews. I'm sorry.
Thank you, Madam Chair. Through you to the administration, last week in the newspaper there was an article regarding the county's contract with Maxim Healthcare Services, and it was reported that I guess this business had faced criminal and civil charges for defrauding Medicaid and Veterans Affairs program, and the comment from the county indicated that we would be evaluating our contract with Maxim to make sure that they were still living up to all of their obligations with us. At this point in time, has that review started, or has that evaluation occurred, and what are the plans to do that?
Madam Chair, if we could have some time to develop a comprehensive response to that, instead of doing it on the fly today, we'd like to have an opportunity to put together maybe a written response we could submit to the committee if that's acceptable.
Absolutely.
Sure, but by the full legislature meeting, would that be possible?
I think that would be possible, absolutely. Yeah.
Thank you very much.
Absolutely. Thank you. Thank you. Any other questions? Legislator Cayley.
Thank you, Madam Chair. Through you to the administration, on the under old business, our question every month: has any decision been made with regards to MCH?
Madam Chair, in anticipation of that question, I did check with the Director of Finance. He has told me that we have not made a decision on that matter yet.
Thank you. Seeing no further business, the September 27th, 2011 meeting of Human Services stands adjourned. The next meeting of the Human Services Committee will be on October 25th at 6 p.m. Thank you.